Hello, everyone. We are going to continue talking about infection prevention and management. We spent a great deal of time during class talking about how we, as healthcare providers, can protect ourselves against infection in the acute care setting. Now, this presentation will focus on education for the patient. These are a few quick facts I found to be interesting regarding healthcare-associated infection. Number one is that healthcare-associated infections affect 1 out of every 25 hospitalized patients, and that statistic is as recent as 2022, which is concerning for our patients. I want you to think about why this number is so high and what might be the cause as we go through these slides. Number two, the cost to the hospital for these healthcare-associated infections ranges from $28 to $45 billion per year. This is important because the Centers for Medicare and Medicaid have a non-payment policy for hospital-acquired conditions, which means hospitals will not get reimbursed for the care of these patients. Number three, infection inevitably increases the patient's length of stay. This generally ranges from an extra 5 to 7 days. This means the longer the patient is in the hospital, the higher the costs of care and the higher the risk of them developing additional hospital-acquired conditions. So these facts are important to know as we start to develop a plan for educating our patients. So why is it important to educate our patients? Well, for starters, hand washing is the single most effective way to prevent the spread of infection. This simple act is one of the easiest ways we can help keep our patients safe. That being said, patients interact with healthcare workers, visitors, transporters, and other patients on a daily basis, allowing for the transmission of infection to several different people. Education is important, though, because it helps engage our patients and motivate them to participate in their care. Patients and their families should feel empowered to speak up and advocate for safe care. Engaging in their care also helps to develop autonomy for the patient. It is important that the patient is aware of their right to play an active role in their own care. This is a short video that I'm going to play for you that highlights the importance of engaging patients in their care.
Don't hurt me. Be nice to me. Heal me. These are the 3 things patients say they want. And as a member of MedStar's Patient and Family Advisory Council for Quality and Safety, I would add one more. Engage me. Engage me in the care I'm about to receive, in the care you would like to provide. Ask me what I want to make sure we are on the same page. If there are options, tell me what they are, and explain the differences so we can make the most informed decisions, the best decisions together. Engage me by explaining the risks, then asking me to repeat back what I just heard. As Don Berwick has been quoted many times, nothing about me without me. Research shows that engaged patients have better outcomes, and we all want that. When they're not afraid to speak up, patients and families can provide important clues that help prevent mistakes and lead to a successful healthcare encounter for both patient and provider. Don't hurt me, be nice to me, heal me, engage me. It's up to each of you as care providers to invite patients to actively participate in their care and welcome their input. See you next time on 60.
So let's talk about how do we engage our patients and their families in preventing infection. Some things we can do are share informational videos. After we've taught the patient or family member something, such as proper hand washing, we can ask them to demonstrate it for us. This way we can confirm they understood the directions and assess how well they performed the task. We also want to encourage patients and family members to speak up, especially when they see something that is unsafe. If you take a look at the picture on the right, this is a promotional poster that was shared by the CDC. It is meant to be placed in areas for patients and their families to see and be encouraged to speak up about healthcare workers not washing their hands. We want patients to know they can advocate for themselves without feeling like they will be compromised, that their care will be compromised in some way. And lastly, we want to use clear and straightforward explanations. This includes involving family members, asking open-ended questions so we know that the patient has understood what we've said, and using the right tone. We never want the patient to feel as though we are talking down to them. Rather, we want them to feel supported and trust our judgment. So now we're going to talk about the key points we want to educate our patients on regarding infection prevention. The first one is hand washing. Earlier in class, we learned the proper way to perform hand hygiene as healthcare providers. Now we want to take that information and be able to teach our patients. The most important times to perform hand hygiene is before meals and after using the restroom. It is also important to remind patients to wash their hands even if they are not visibly soiled. A study by Chung et al. Found that only 52%, a little over half, of patients reported performing regular hand hygiene while in the hospital. Only 49% of those patients reported washing their hands after using the restroom, and 11% prior to having a meal. So can anyone tell me what barriers may be preventing patients from performing proper hand hygiene? Okay, great. Everyone brought up a lot of good points. Let's take a further look into why patients may not be washing their hands. First of all, patients may be bedbound and unable to get up to a sink to perform hand hygiene. They may also not have access to soap or hand sanitizer inside the room. There are situations where the patient does not have a bathroom in the room or the closest hand sanitizer is outside of the room. If you think about the emergency room, someone who's being triaged or waiting to be admitted may be sitting in a small bay and not have access to wash their hands. Also, patients may lack the education of when and how to perform proper hand hygiene. This could potentially be due to limited health literacy or language barriers. So it's important that we take these things into account when we do provide education for the patient. The next key education point is maintaining good personal hygiene. We want to remind the patient that we can help prevent the spread of infection through daily showers and the use of sanitizing soaps. It is also important to instruct the patient on proper cough etiquette. The CDC's recommendation is to cover your mouth and nose fully with a tissue when you cough or sneeze and immediately throw used tissues in the trash. It is also acceptable to cough into your elbow, but avoid coughing into your hands. This leads us into our next point of keeping the patient's surroundings clean. This includes throwing away any garbage, removing any opened food items, and disinfecting frequently used surfaces. And last but not least, managing toiletries. We want patients to be aware of checking expiration dates and getting rid of anything that's expired that they may use on their face or on their body, because these can harbor bacteria and different viruses. Now, we will discuss educating our patients on proper nutrition and water intake. Firstly, we want to encourage our patients to eat a well-balanced diet. This includes a diet with vegetables, fruits, whole grains, lean meats, fish, eggs, nuts, and low-fat dairy products. It is also important to educate patients on the necessity of certain vitamins for our immune system. Micronutrients include vitamins such as A, B6, B12, E, and several others. These micronutrients help support the cells and tissues of the immune system, increasing resistance to infection. Vitamin C is helpful in reducing the risk and severity of upper and lower respiratory tract infections. A patient with an infection may have increased requirements for vitamin C. Vitamin D should be supplemented daily and reduces the risk of acute respiratory tract infections and respiratory morbidity. Omega-3 fatty acids help support the immune system by resolving inflammation. Any questions regarding the importance of these vitamins? Okay, great. It is also important to mention adequate daily water intake. This consists of 9 cups of water daily at 8 ounces each. Lastly, we will discuss the importance of educating the patient on daily physical activity. Studies show that people who are physically active are more resilient to infection. Performing 30 minutes of moderate to vigorous exercise 3 to 5 times per week helps to improve the cardiovascular and metabolic systems. Activities can include walking, running, cycling, or anything the patient may enjoy that gets them up and moving. So, let's review a study by Chaston et al., this was from 2021, that looked to examine the association between regular physical activity and the risk of infectious disease. The study found that consistent physical activity is associated with a 31% lower prospective risk of infectious disease and a 37% lower risk of infectious disease-related mortality. So why is it important to have evidence-based research available? Studies like this help us to guide our education and provide the most up-to-date information for best practice for the patient. So at this time, if anyone has any questions, please ask before we move on to our next topic. Thank you.